We're still here with Kwabena Mintah Akandoh. He's the Minister for Health, and lots of things have been said. We've discussed his style, visits to hospitals and announces it's not going to stop. We've discussed the backlog. We are told close to 75,000 health professionals. Some have been in abeyance since 2019, a lot since 2021. He can't tell me exactly when all will be employed. He says there's a plan. And this is all kinds of people. Some are pharmacists, some are medical lab, health, and all kinds of things. And apparently by 2028, if we don't employ these 74,000, we'll have 180,000 health professionals. But doesn't the private sector employ nurses? Why does government have to employ all these guys?
That's another question. But at the end of the day, I mean, government must create the environment.
So does it mean that health facilities, majority are owned by government?
The health facilities, yes, or the health and the nursing training schools?
Health facilities that employ people, majority of them are government owned. Or usually you employ a chunk of, it's like teachers.
Yeah, the majority of them are owned by we have, from the primary healthcare level alone, I think we have over 9,000 health facilities.
But why are you training our people and they're also leaving us? Doctors are leaving. I'm told the training of a medical practitioner, whether it's a doctor or nurse, is subsidized. You are telling me you are going to even send some away to other countries. But you go to many regions, there are no doctors. You go to many, in fact, if I go to your region of birth,
as for the medical
there's
doctors,
a paucity of medical doctors
as for the medical
in the rural
doctors,
areas.
No, for the medical doctors, you are not sending anybody away.
They are going on their own. You don't need to send them.
Of course,
and you can't stop them, but you subsidize their training.
Yes. So
why are you subsidizing doctors' training and allowing them to go?
You can't. I mean, if you say
give them incentives to stay.
You know, Bernard, one thing we must, as a minister, I would have wished that we would give every health professional what he or she wants. But we can only take from their budget. We can only take from
I
the
remember in the past, they were helping them acquire cars at a cheaper rate or sort of tax-free or something like that. But I think somebody stopped it. Are you aware of this? Because some doctors complained in the past that it was difficult for them to bring in those cars or something as part of the package for them to feel incentivized to stay.
Yeah, I mean, something of that nature was done last year. And then the interesting aspect was that they were promised that they were going to have tax waiver, properly so-called. But that was not what happened. It was like whatever they imported was charged against the Ministry of Health, budget.
So it was deducted from your budget?
It was deducted from the ministry's budget. So it was not a tax waiver.
So who stopped it?
Even when we took over as government, they had imported some of them. So I had to go to the Ministry of Finance, spoke to the Minister for Finance, so that we could clear all those cars that had already been imported. Some of them even went to demurrage. We had to also clear the demurrage and then give out their cars. So now we are looking at it. We are looking at how we can organize it well and give that kind of incentive to the health professionals. It's something that is on our
Because as a minister from a rural community by birth and training, and a deprived one at that, you should be concerned about the skewed distribution of doctors in particular.
I am very, very much concerned.
So what is your plan to ensure that doctors agree to go to underserved areas?
So we have an incentive where we are planning to define what we call underserved communities. Okay? I mean, there could be a facility in a city or urban area, but it may still be underserved. So we are defining what underserved community means and trying to come out with some kind of incentive like 20% of the basic salary for health professionals who accept postings to the rural areas. So these are some of the things. And then giving them promotion, I mean, earlier than those in the cities. And all. So there are a number of incentives we are planning.
More comments coming in. Good evening, Bernard. There's one ChannelOne hospital in Deme, in Afajato South District, which, when completed, will serve the catchment area. Yes, value for money audit is necessary, but I will plead with him to take a second look at it due to the unavailability of health facility in that area. This is Jones Adoboy from La. Yeah. He's making a special case
for a particular facility. There are some districts without district hospital at all in the country. And we'll take...
Which is why I'm a bit concerned that you are saying 70% and above government will finish. Because if Deme is 20% complete, And they are not getting a private sector person because the hospital may not have the...
We'll give a special dispensation to those groups.
Yeah, so then I expect you to be a bit more nuanced because you're saying it's 70%.
Yes,
and
that's
above.
the general, that's our general, that's the position. But then, districts where there are no district hospital at all, we could give some special dispensation and look.
There's a very long one here from Ernest Jiwonu, and I'm going to try and summarize it. It says, Bernard, medical lab professionals have had this problem and have complained not less than 3 occasions and even gone on strike over this particular matter. We must not wait for this innocent minister to make this catastrophic mistake by simply handing over the labs and its related equipment to a private entity. Or investors would mean the introduction of cash and carry. At the very beginning, they would deceitfully say it will be covered by the health insurance. Once the takeover is complete and the sick populace becomes dependent on this equipment, the Association of Hospital Lab Services Providers or private entities will come together and say that the tariffs as provided by the NHI are not realistic, and so they have to receive top-up and introduce cash and carry. It's a long story. Basically, he's saying that...
So let me clear some...
Let me try and understand the comment. So he's saying that... Okay, have you said you are handing over any labs to private operators?
No, that's not what I'm saying. So please get it clear. We are simply saying that the private people or the vendors will put the equipment at the facilities. They are not the ones going to run it. They are not the ones going to employ these laboratory technicians or whatever. It is government that is going to. So as I told you, I met them yesterday and I explained some of these things to them. One of the concerns were the fact that if you give it to the private sector, then the private sector is the one going to do the recruitment and it may hinder the recruitment of these professionals in the system. We've made it clear that all that the private sector is going to do is just to put the machine there. And again, even when we pay them, there will be another profit sharing arrangement between the facility and the vendor. Okay? And then in any agreement that we will sign, we are not going to allow them to charge their own fees and charges. The fees and charges will be subjected to Fees and Charges Act of Parliament. The fees and charges will be subjected to the tariffs of the National Health Insurance. These are all conditions.
Okay, he's suggesting that you should set up a hospital lab account similar to what happened between the 80s and the 90s to address shortage of medicines at the hospital in the form of revolving drug fund. This mechanism will ensure the abuse of drug funds should stop. The hospital lab account will completely solve the problem and pay for the services. So I don't know what that is.
This was my initial position when I took office, that they should ring-fence some money to fix the machines when they are faulty and all that. But you should be listening to the Public Account Committee, what they are even doing with this pharmacy accounts. You should be listening. You understand? And so if you decide to do that, what about the hospitals without the full complement of equipment? It will take government more than 10 years to be able to provide all the required equipment in every health facility. Okay. We don't have that money. And that is the truth. Maybe I'm being too frank.
All right.
So we have to bring the private sector in. If we go by this approach, what it means is that we can fill most of the hospitals at the same time because the money may not come from government at the same time. But if we decide to wait, let government come buy all the equipment that we need in all the health facilities, we'll have a problem. But that notwithstanding, I'm open. If you have ideas, we can still further fine-tune it. But there will be profit-sharing arrangement between the vendor and the facility, the health facility. And then it is not as though it is the private sector that is going to manage or run the labs. No. The labs are just going to be run by the hospitals as they do. They are only going to put the machines there and keep their eyes on the machines. When the machine is faulty, there's an engineer on the standby to fix it. There's a group, engineers, to train the health professionals how to use the machines. This is what we are bringing.
Let's deal with free dialysis. You announced on Monday that the president has directed that the government dialysis subsidy be extended to private health facilities. Just put a bit of flesh on this. So is this for all?
Yes. So at the moment, per the National Health Insurance tariff, dialysis per session is around approximately 500 Ghana cedis. So what we are saying is that not all the patients go to the public facilities, okay? So Bernard will go to a private facility, and the private facility will charge, let's say, 1,500 Ghana cedis per session. But government will then come in to pay that 500 we pay to anybody who goes to the government or public facility. So we pay that 500 for you. If it is 1,500, then you top up with 1,000. That's the policy we are going to roll out.
Beyond dialysis, there's concern about kidney and organ transplants generally.
Yes, that's another
How far have you gone with the legislation for kidney or organ transplants?
Yes, so we are still looking at, we are still at the consultation process. So we are evolving the policy, and after that, we'll go to, stakeholder consultation, we'll then go to cabinet for cabinet approval, then we'll go to parliament. So we are still at the stakeholder consultation level. There's
a pushback from somebody in the pharmaceutical sector when you said that NHIS, let me read this is from somebody from the pharmaceutical manufacturers. Bernard, the minister has not been truthful on the payment to NHIS, of NHIS to the facilities. Yeah, this is from somebody in the sector. So what did you say about payment? You said they are paid in a month.
Payment is prompt, and we are paying monthly.
What? For all types of facilities?
All service providers.
Does this include to pharmacies?
You see, pharmacies do not have direct relationship with national health insurance per se. Okay. It is a health facility like the hospital, and that is included. So when you bring your claims, it is part of what you submit to the national health insurance. And I can tell you, Bernard, I can tell you on authority, if your facility maybe hasn't brought their claims, then that's their own problem. Or if there's and you see sometimes once a while, and that is even less than 10%, the system will skip a month or so. And even the practice is that 3 months arrears is allowable. And I'm saying that we don't even keep up to the 3 months arrears. We are paying monthly, promptly. And if he has any special challenge, I encourage him to come to the head office.
Good evening, Bernard. Tell the Minister of Health that all the sterilized machines at Korle Bu Teaching Hospital are not working, and he should deal with it. There's no name attached to this message. Have you heard about this? All the sterilized machines. I don't know what you mean by that. Sterilization or sterilized machine.
I've not heard
at
about
Korle Bu. Will you pay a surprise visit?
But if I announce it, it's no more surprise visit, Bernard.
Will you pay an announced visit? Please. Good evening, Bernard. Many institutions have stopped training physician assistants. Kindly ask the minister if it's government strategy to stop training physician assistants.
No. The answer is no. It's not government strategy to stop training physician assistants.
It's unjust to politicize the clearance of health professionals whose credentials expired prior to NDC's tenure and were absent in the transition notes. The current minister is committed and working tirelessly to resolve this issue, ensuring these professionals are absorbed properly. Let's support efforts to improve healthcare rather than politicize challenges for political gain. Mausi Ayebi, Abutia Teti. Bernard, I want to know if there are HPV vaccines available for women around 40 years. If yes, how do we access such facilities? Thank you.
Should I answer that?
Yes, I answer that one.
Okay, so HPV for now, according to statistics, about 3,000 new cases are recorded every year. And out of the 3,000, the mortality rate is around 2,000, very, very high. So government has adopted some approaches. So number one, cervical cancer or the cancers are part of the NCDs, the non-communicable diseases. And so what we are doing is that we've targeted girls aged 9 to 14. Yeah. And we are targeting 2.4 million girls. At the moment, we've been able to vaccinate about 1.8 million girls at the end of day 5. And we are determined to, do the mop-up to hit our 2.4 million. And then we are also trying to put machines to do screening, early detection. When you detect them early, it is curable and all that. And so we are trying.
So this human papilloma virus,
exactly,
cervical cancer.
Yes. So we are trying to put. So now we've installed, by the help of Telecell Group, we've installed a machine at Korle Bu, one at Seviyoso, one at Tamale. We're expanding them for early detection, but we don't have vaccines for the aged or the 40 years group or whatever.
Minister, a seasonal influenza outbreak has been reported in parts of the country, with eastern and central region experiencing an outbreak of H1N1 influenza subtype. Reports also indicate that Greater Accra region is on high alert, with health authorities continuously monitoring the situation. We've already confirmed 42 cases of H3N2 influenza subtype. What is your briefing on this And what intervention are you going to introduce to stem a full-blown outbreak of H1N1 or H3N2? I suspect this is bird flu.
Yeah, it's unfortunate, but it's normal. It's seasonal, as you have indicated. And so around the cooler months, we get some of these outbreaks. And so at the moment, the Ministry of Health through Ghana Health Service, they are coordinating with the various schools. It's very pronounced at where there's overcrowding. And so we are providing hand sanitizers. We are sensitizing people as and when you feel your throat is itching you are feverish and all that, you report to the nearest hospital. So the Ghana Health Service is collaborating with areas that we have detected this, flu and monitoring. So far, we don't have any critically ill person who has been admitted. And so we are on top of it. There's no cause for alarm.
Somebody wants me to ask you what you are doing about staff who divert government money into their private pockets. Some of these staff undercharge clients and pocket the money. Urgent actions need to be taken. Ntifafa from Avle is asking this question.
Once you divert the state money into your coffers, it's criminal and you'll be prosecuted. Anytime we find such issues, the law takes its own course. The law takes its own course.
Bernard, your guest is presenting the data as if no one is retiring. How many retire a year? Over 80% of doctors in Ghana are in our teaching hospitals. Unless he's able to decentralize specialist training, move them to the regions, we are not going anywhere. This is a doctor saying that the reason they are in the teaching hospitals, obviously, is because they lecture as well. And so it's almost like it's not a question of just giving them cars or whatever. If training is not decentralized, you are not able. Do you understand? If
training.
Yes, if I'm a specialist,
yes.
I will have to be in Kolebu or UGMC or
as part of the Mahama Care. Maybe let me tie in with the Mahama Care. As part of the Mahama Care, there are some gaps. The specialists we need to treat these non-communicable diseases, we have a huge gap. So we are looking at decentralizing the training of specialists in this country. And by the beginning of 2026, we are starting 3 new regions. I think Wa, Ho or Hohoi, and then Bolga. These 3 hospitals we are going to decentralize. So we will gradually decentralize the training of these specialists in some of our regional hospitals. So it's something, and it's one of the mandates of the Mahama Cares to be able to fund that particular training to fill that gap.
President Mahama hosted a health summit in Accra sometime a couple of months back. I think it was the African Health Sovereignty. And it appears there are efforts to raise more financing for doing a lot of things. Can you give us an overview of that? Is it to say we are going to depend less on donor support? Africans must come together to provide money for their healthcare financing? It was a health financing conference at which you spoke. What was the big plan for that?
Well, His Excellency John Dramani Mahama is so committed to the health sector, and he's leading something on the continent that we must take our destiny into our own hands. And therefore, we are encouraging all African countries to up their domestic mobilization of resources when it comes to the health sector. That is a summary of it. So, for example, we have the national health insurance. Some countries don't. We have brought Mahama Cares. So these are all domestic mobilization of resources. And when you have this domestic mobilization of these resources, nobody anywhere would dictate to you how to use that money. You apply the money where it is needed most. But when it is a partner or, somebody bringing you the money, it comes with strings. And what His Excellency John Dramani Mahama is saying is that the resetting agenda or the sovereignty doesn't mean isolation. It doesn't mean we don't need partnership. We need partnership, but what we are saying is that the partnership we need must make sense. And every partnership we need must be country-led. We must lead those policies. We know what we need most, okay? And so, 1, it's about domestic mobilization. 2, it's about using the resources you mobilize where it is needed most. 3, it's about partnerships that make sense. In the health sector, for example, we have about 3 main priority areas. 1 is how to make Ghana a pharmaceutical hub. You realize that during the COVID pandemic, we suffered before we even had vaccines. countries looked into our eyes and told us, look, we're not going to give you vaccines until and unless we finish vaccinating our citizens. So we've learned from that. And we are going to exit Gavi. Gavi is, they help us to procure most of our vaccines and all that. So there's a clear plan to produce vaccines in this country and to up the percentage of production of pharmaceutical products in this country. It's a priority area. And then the second one is how we can tackle the non-communicable diseases. The non-communicable diseases constitute not less than 40 to 45% of our mortality rates. So how do we handle that? We have two approaches there. One, free primary health care. Free primary health care, in order to quicken our journey or our steps towards the universal health coverage. Free primary health care, in order to increase screening to detect those conditions on time, to be able to avoid its complications. Free primary health care. Free primary health care, in order to erase the cost that hinders the progress of universal health coverage. Now, Mahama Care. This Mahama Care is dedicated towards the funding of these non-communicable diseases. Because you realize that when people have these complications, hypertension, diabetes, and what have you, it draws them into poverty. They don't have the money to fund it, the cancers and what have you. Okay. You understand? And so these are some of the policies that dovetails into the health, sovereignty, the resetting agenda.
A couple more issues to do, and thank you for staying. I know it's been a long day for all of us. The nurses, and this is not new nurses, this is old nurses. In June, they declared a strike or threatened a strike over conditions of service. You gave them some commitments, but we've seen some agitations in October. NLAC has also said some of the actions have been illegal. I think this has to do with their conditions of service and allowances. What is the update on?
So now it is one of the conditions of service that was signed and never implemented when we took office. So out of those conditions of service, what I can report now is that fortunately we are now implementing 2 out of the items they are demanding, and we are still in talk with them to make sure that the rest are implemented.
2 out of how many?
I think 2 out of 6.
When was the last time you engaged them?
The last time we engaged them was more than a month ago. By the last meeting they had was with the Fair Wages and Salaries Commission, yeah.
There is an Mpox outbreak we've been battling with. The numbers keep rising slightly. What is the update? Is there a vaccine yet for Mpox?
Yeah. So the update is that we have about 730 new cases for now cumulatively, and we have secured vaccines, and we are targeting about 19,000 people to be vaccinated. There are some areas that are more endemic, and so we are targeting about 19,000. So far, we've vaccinated 15,000 people, so 4,000 more to go. 2 deaths.
It seems to me as if healthcare in Ghana is sickness care. We are always talking about medicine, vaccine. What is your plan for health prevention and public health education? Because almost like every time, let's buy medicine, let's buy equipment, let's buy drugs. But there's something to be said for people not falling sick and also behavior.
Fantastic.
What's your plan for that?
So the free primary health care will give real meaning to the preventive. So people will come and measure your BP. You will go to the hospital not only when you are sick to know your sugar level. You understand? Screening, early detection of these complications. They are all going to be part of the package with the free primary health care. Okay, how we exercise, how our chip compounds will send the healthcare delivery to the doorstep of the people, educate people, sensitizing people, how we can get airtime on the various radio stations, the information centers, to be able to educate people. They are all part of the package of the free primary health care. Yeah.
Let's talk about your constituency. So, you are from Joabuso, I see. What is your region, one of the poorest in the country, basically, the Western North. It's a new region. It was split from the Western region.
Did you say it's the poorest?
One of the.
It's not in my region. I disagree with you. My region is not poor.
Oh, okay.
If you say it's one of the new regions,
Okay,
I agree.
I thought it was a deprived region.
It could be deprived.
And you are the only cabinet minister from the region.
Yes.
From the
for
region.
now.
I see. So Samson Ahi is deputy minister
for agribusiness, trade, and industry.
I see. Is Galamsey taking place in your region?
Galamsey is in my region. It's in my district. It's my constituency.
How concerned are you about that?
Very, very, very much concerned.
Somebody says we should declare Galamsey also as a public health emergency because of the effect it has on people's health, chemicals in food and water. Is this something worth considering?
I think we will take the approach we are taking at the moment, trying to clamp down on the Galamsey, educating the people, bringing everybody on board to fight it, and I believe that we'll all succeed. It's a major concern, especially to the health professionals, because the impact of Galamsey to our health. Do you know it's one of the causes of the NCDs?
The non-communicable diseases?
Yes. The cancer, sometimes you give birth to babies with deformities. It's as a result of this, Galamsey. So it's a major, 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 major concern.
Can you lead a public education campaign in your region about the health effects?
Yeah.
It is and should the Ministry of Health play a more frontal role? I hear doctors talk. I don't hear the ministry issue statements on Galamsey.
I agree. It is something we are considering. We want to, you see, this is inter-ministerial to tackle this fight and to be successful. So it is something we are considering to also help in the fight against Galamsey, the sensitization from the CHIPS compound to the health centers. So you see, these people live with the people in the various communities. That is how decentralized the health system is. So it's something that we are designing to charge our people to also go out
because
there.
Because there's a public education component of Galamsey. In some communities, the people actually don't see anything wrong with mining in water bodies. And they say it's their gold. The mining companies have come, they haven't gotten anything. So there's a lot of public support in some communities for Galamsey.
Yeah, it's true. In some communities, when you even go, fighting Galamsey, they get these Galamseys and hide them in their rooms. They protect them.
They protect the Galamseys?
Yes, they do. I'm coming from a mining constituency, so I know what happens. And so it's something we are planning to do. We are, looking at how we can even get, in the rural areas, how we can get airtime on the various radio stations, the information centers, and try to educate people, reach out to the people in their mosque, churches, to talk about these things. So it's something we are considering very well.
Will Muhammad solve the Galamsey problem?
Why not?
Because it doesn't look that way. A lot of people are unhappy with the pace of work.
I am very, very, very confident that we will make a great difference. But you see, when you start a new government, you always have challenges. You will always have challenges, especially issues like Galamsey. It's not an easy fight, but we are determined to fight it. And the health ministry will come on board strongly. Yeah.
What's your message to your constituents as we close?
Well, I just left my constituency, and by the grace of God, I commissioned a sports complex for them. I started somewhere last year, and they played a first division match on Sunday before I even left to Accra. And so,
is there a first division team in your hometown?
Yes, Sefi All Stars.
Sefi All Stars, yes. Division 1?
Division 1.
So you build a sports complex for them?
Yes, a sports complex for them.
I see.
It's not AstroTurf. This is a solid sports
grass.
A proper grass, and then inner perimeter,
what capacity
dressing
stadium?
room. I think it should be able to take more than 5 to 10,000, between 5 to 10,000 people. Wow. Yeah, between 5 to 10,000.
So there's a Division 1 team in your hometown?
Yes, there's Division Sefi All Stars. So we are determined to continue the building of the chip compounds in my district. We are determined to do the roads, connect to the rural.
Do you still get time to farm?
Yes, I farm, but I don't get the time as I used to.
What do you farm?
I farm rice, from farming to processing to distribution, the full chain.
How long have you been farming?
I've been farming commercially. I've been farming since 2013, 2014, commercially.
You're a commercial farmer?
Yes, I'm a commercial. Arguably, I'll be one of the biggest rice farmers in this country.
Will you enter the best farmer awards?
No, for now.
Or you are politically exposed?
because of the work I'm doing at the moment, I have laid the cutlasses and what have you down for now. But people are...
There's a lot of questions for you. We don't have time, but the truth is that your sector has many issues. We thank you for speaking to us. We wish you well in your efforts to try and solve some of these problems. We'll be speaking to Kwabena Mintah Akandoh.
That's all time can allow us?
Yes.
Okay, thank you. I thought you had more questions and you had more time.
I have a morning show tomorrow. So
Bernard Avle, we're going.
I have to be on the radio in the morning. So
that's on the lighter note.
We will invite you to come back maybe.
There are a lot of problems.
Next,
and you see, the public interest in the health sector is very, very high. Understandably so.
I see.
Because the survival of the citizens in the country depends on that sector. And even some way, somehow, it has some direct correlation with the productivity of the country. So everybody's in it. So the slightest thing drop in the ministry, everybody gets to know and everybody wants to follow it religiously.
Yeah. You have a very active population of nurses and doctors who express themselves. We wish you well in handling them. Thank you. That was Kwabena Mintah Akandoh speaking to us on The Point of View. We'll see you next time. Good night.